Welcome back to Leading Experts, everybody. I'm Grayson Foster. Joining me today on the show is Dr. Alan Nazeri. He's a cosmetic and general dentistry and obviously does beautiful work, which we've just been taking a look at.
Thank you very much.
All right, I want to ask you, how do you define cosmetic dentistry? What does that term mean to you?
You know, cosmetic dentistry is a branch of general dentistry, and you know, anytime a procedure is done for a patient, if the cosmetic aspect of it is considered during the treatment, basically you're doing cosmetic dentistry. But generally has to do with the overall comprehensive care of the smile and how we make the smile look.
How do you decide, like, what's going to be the shape, what's going to be the color? What are you actually going to do for that particular patient?
Yeah, Grayson, that's a great question. One of the challenges that I think many dentists who don't practice cosmetic dentistry is that they don't communicate that very well, or I should say they don't do cosmetic dentistry routinely. We have a series of questions and communication steps that we go through to find out what it is that each patient wants, what is it that they want to look like, what color they want their teeth to look like, and so forth. So everything we do in our practice is customized to exactly what the patients have in mind.
Now, besides the cosmetic work, you also do the foundation, or the structure as well, in terms of doing like a dental implant or a mini dental implant. I want to take a look at one of your patients that I know you said you did a full mouth reconstruction on her.
Yes, this is Betsy. Betsy actually, even though at our practice we provide both the surgical aspects of the implant placements as well as the restorative part, which is the crown part and so forth, Betsy was a fairly large and a complex case of implant system, which I teamed up with one of the best surgeons in town here, Mirage Center, Dr. Peter Shear and his team, and we constructed about 24 dental implants as well as full mouth reconstruction for Betsy.
And how long did that process take?
Well, the process took probably close to about 2 years to get completed.
Right.
But at all times she had beautiful smiles, and if you talk to her, she has become one of our advocates for our practice. She will tell you she has been very comfortable throughout these 2-year period and so forth. So case turned out to be really great.
Beautiful, beautiful after smile. What types of treatments fall into cosmetic dentistry or cosmetic category?
Bonding, veneering, teeth whitening, and everyone is basically a candidate for teeth whitening. And even if there are patients that wear dentures, we can replace the teeth in the dentures and make them whiter and so forth. So cosmetic dentistry is a full range of different things that we could do for patients.
What are the most common requests that you get from your cosmetic patients?
Well, most of the patients who come to our practice, they have had a lot of old restorations that they need to be upgraded. So aesthetic is one aspect of it, but they're really looking for better oral health, better function in their mouth and so forth. But because we have such a high aesthetic component in our practice, we take a lot of that into consideration and make sure that, aesthetically the outcome is acceptable to the patients.
All right, let's take a look at this patient here. What did she want to have done?
Well, this beautiful lady that came to my practice, she had a, bunch of really old restorations in her mouth, teeth that were discolored, the teeth that were worn out and so forth, and she just wanted to make things healthy. And we talked to her about the aesthetic aspect of it, and she was reluctant at first, but then she went ahead and did it, and she tells me it's probably the best investment she has ever done on herself. So
it's amazing. I mean, it just, her whole face, her eyes, everything just looks so much different.
I will tell you, I know plastic surgeons may not like to hear this, but I think as dentists we really own the face, because we can really create a beautiful smile for our patients. And a smile is basically the centerpiece of someone's face, so it's very, very important to have the teeth done correctly. So
I want to get onto this case, because this looks like an interesting case here. What did he come and see you for?
Yeah, Robert came to see me again for a consultation regarding his bite and the way his teeth were. Again, a lot of old restoration. If we go to the next picture, I can show you what Robert's bite looked like. His bite is way over collapsed, and also he's missing a tooth right in the front there, on the lateral there. So, you know, he wanted to see what we can do for him, and these are very, very challenging cases where we have to not only fix the aesthetic aspect, but also fix the bite and so forth. So we were able to successfully complete this treatment for him, and I can show you on the next photo that, you know, he became an extremely happy man. And I think we also have a photo of him, and yes.
That's amazing.
He's not biting in the back when we took the photo, but yeah, that's what we ended up doing, and we actually gave him an extra tooth in the front and so forth. So it became a huge, huge success with this case.
And how long did his case take?
Roughly about 4 to 5 months to have it all completed.
Oh, that's great, actually.
Right.
We've seen some great before and after pictures. What if someone's tuning in right now? What would you say is the difference in cosmetic terms between having a lumineer done and a veneer done? Right.
You know, lumineers are a type of a veneer, a type of a dental veneer. They have, you know, very strong marketing out there. They do a lot of marketing in magazines and TV shows and so forth. And I think some of that marketing is hype because of the fact that, you know, you know, to do veneers properly, you really need to reduce the tooth structure, unless the tooth is very small. If you have a tooth and you're just going to add a layer to it, it's going to become very thick. And I see many cases in my practice where patients come in, they have irritations with their gums because those veneers have not been finished properly, they cannot floss them properly, and, you know, they look kind of blocky. Having said that, lumineers do have their place in dentistry in certain cases and so forth. But veneers and lumineers is just an interchangeable terminology, pretty much.
We're going to take a break, doctors. Stay with us, everybody. Leading experts will be right back.
Welcome to come into our office if they're considering a tooth to be extracted, whether they're considering veneers. Again, we are a general dentistry office. We do dentures, partials, all range of general dentistry. So they're welcome to come in. We would provide them a complimentary consultation, and we will make sure they know all of their options, and financially they're aware of what everything will cost.